Building tomorrow's ICU.
Hello and welcome to our special episode Building Tomorrow's ICU, a show where we explore the innovations shaping the future of healthcare in India. I'm Radhika Sinha and today we are focusing on a project that's changing the way we look at critical care. A landmark 1,200-bed facility at Yashoda Medicity in Indirapuram. The hospital features one of South Asia's first 250-bedded modular ICU setups, one of the largest of its kind in the country, built in collaboration with global medical technology leader Dräger. So in this episode, we'll uncover the big vision behind Yashoda Medicity, understand how this partnership with Dräger made it possible, and look at the technology, training and patient impact that sets this hospital apart. And of course, we'll also discuss what this means for the future of Indian healthcare. So joining me today are two leaders behind this story. Dr. Upasana Arora, CEO and Managing Director of Yashoda Medicity, and Mr. Shalin Patel, CEO of Dräger Asia Pacific and MD, Dräger India. Welcome to the show.
Thank you.
So let me begin by asking you, Dr. Upasana. Now, Yashoda Medicity is one of the most ambitious healthcare projects in North India. So what was the big vision behind setting up, building this future-ready facility, and also how does it reflect Yashoda's evolving role in Indian healthcare?
Actually, Yashoda is my mother-in-law's name, who expired because of cancer, and in her memory, we wanted to create an institute which is going to cater, years after years. We have a big facility, latest technology, even helipad facility is also available. Reason behind this, I am basically known for patient-centric approach, and I always want to keep my patient safe in the hospital. So that is how this picture came into my mind, that we should make Dräger our partner. And they have made our ICUs, our OTs, and all our MGPS. MGPS means medical gas pipelines. And same time, we are using lots of things from Dräger, like anesthesia and ventilator. This hospital is a futuristic hospital, totally digital. And because they have provided us that kind of technology, so that our doctors, if they are not in the hospital and their patient is admitted in ICU, there are two kinds of doctors in a hospital. One who is always present in the ICU. We call them, critical care expert or anesthetist. And there are doctors who are their consultant, main consultant. They can see their patients' all vitals on their devices. So everybody who is working for that patient is always aware how their patient is working on. And I am thankful to Dräger that they have actually helped us to create this wonderful facility.
Dr. Upasana, that's definitely a powerful vision which needed the right partner, and that's where Dräger India comes in. Mr. Patel, what makes this collaboration with Yashoda Medicity so special?
Well, first of all, thank you for having me, and also thank you for that opportunity to partner with you. For us, this was really an opportunity to do something transformational in the Indian healthcare landscape in a partnership with Yashoda. And we were looking for benchmarking and showing what is possible in India and how we can take healthcare and in particular operating theaters and ICUs to the next level, where Dräger for 134 years has been contributing and where today we continue to contribute. And the close collaboration, the alignment with the vision, that was the real opportunity for us. And we could really showcase what is possible, how to improve healthcare, and what else can be done to improve patient outcome.
Well, vision is one thing, but making it a reality is the real challenge. Dr. Upasana, it's a huge facility and it must be a really challenging task for you. Take us through that journey, right from planning to execution, and just highlight some of the key features of this ICU facility.
So I must tell you that it was not an easy task for us, as it's a husband-wife duo. There is not many people are involved in this project. Any patient is coming in, there is MRI available, CT available, echo available, ultrasound available, X-ray available, everything under one roof. And there is an ICU also attached to the emergency. So if somebody who got a stroke or heart attack, they can treat there. They should not go to the radiology, especially for any test. And there is a lift also available to take them to cath lab, OT, and DSA lab. So purpose was to save the golden hours, but now we could save golden minutes also. When things come to patient safety, I was always there to tell that I really want my patient should not get any HAI, hospital acquired infection. So we have made beds according to our needs, and they helped us in that there has to be a particular difference between two beds. If there is a need of a negative pressure or positive pressure, they have made that. There is a partition also if some infected patient is there. There is a separate room for isolation room is also in ICUs. So there are many things which was just, you can say, lots of discussions, lots of thoughts. We were sitting, we were discussing, and then we could make this possible. I tried to make this hospital stress-free but equipped with latest technology.
Well thought out and patient-centric ICU. So let's elaborate a little bit on the technology part of it. What makes it so special? What special technology that you've used in this specific ICU?
So Dräger stands for Technology for Life. Yeah? And Technology for Life is not only about certain devices, whether it's a ventilator or anesthesia machine. It actually starts with infrastructure. And basic infrastructure is a stable and consistent gas supply, yeah, and clean gas as well. So we, in our partnership, that's where we really started and say, okay, let's start with the basics. Let's make sure with the Dräger MGPS, we are able to supply gas, and that consistently and always at 100% plus. That's a starting point. Yeah? Then we look at preventing infection. So when we look at, for example, operating theaters and the walls and the panels, the solutions that we were able to provide make absolutely sure that there are no cavities, there's no areas where bacteria or other things can accumulate, which eventually lead to some level of infection as well. And then from there, it really goes into operating light. From there then to devices like anesthesia devices or ventilators, where again Dräger is actually invented most of these more than 100 years ago.
Dr. Upasana, coming back to you, looking ahead, which emerging technologies, like AI monitoring or maybe data analytics or remote ICU management, do you think will become essential in critical care in the long term?
Government is trying to provide health to each and everyone, and they started this Ayushman Bharat also. But manpower is not that much sufficient for India because we have large population. So these kind of facilities are now, we are able to provide them through telemedicine, through ICU, e-ICU. What is happening, like in some places, especially I am talking about rural areas, there are few doctors who are working and who are taking care of sick patient also. But there is a need of some expert. So we can provide them all those expertise from here through telemedicine thing, or they can guide them how to go further. Even in our operation theaters, which made by Dräger, we have a big monitors where we can connect with the anywhere in the world. It's not only India. If we really want to showcase our work somewhere, we can direct telecast that operation. If my doctor wants to get some advice from somebody in America, that doctor can join in and he can guide him. So these kind of technology is going to be very, very essential after some time, because you know how many doctors we can generate. These days every district has a medical college and we are trying to provide more doctors, more nurses, but still population is also growing. So if some hospitals can handhold nearby small cities or small villages, it is going to be very beneficial for the government also. Like in Yashoda, we are going to handhold our district hospital. We will provide them all these facility in NICU, in ICU. NICU means neonatal ICU, where newborn babies we are keeping. So these kind of things are boon for those who are not getting any kind of help, or they are not having these high-end technologies. We can provide them such kind of guidance from here. My doctors can go them to train them, and then they can talk to them through these monitors. They can, my doctors can also watch all the vitals of the patient and then tell them that this is a critical time, you have to intervene. So these things are very essential, and after some time, I am all the time talking to the government that all big hospitals should handhold a small CSC, PSC, nearby small hospitals, so that everybody should get that kind of technology which big hospitals are using for their patient, because health for everyone has to be in India. That is my dream.
Absolutely.
Yeah.
What a wonderful thought. And Mr. Patel, technology is one thing, but you need the right manpower to actually leverage it, right? So how did you educate the doctors and nurses at Yashoda Medicity?
We have a vertical called Dräger Academy, and in Dräger Academy, we train all the nurses, all the healthcare practitioners on our devices, on the technology, on how it can also support telemedicine in terms of interoperability, connected devices. So all this training is provided. We also have recently launched a virtual reality training. So again, trying to increase our reach, because obviously all the healthcare practitioners are very busy. So to take them out on the daily routine and then to train them is sometimes a challenge as well, just from a time management point of view. So we've come up with modules which are based on virtual reality, where the usage of the technology that we provide can be trained, optimized, and improved as well.
Well, that's such a great initiative. Well, on that note, it's time for a short break. We've seen how vision and technology came together to create this state-of-the-art facility. But after the break, we'll talk about what this means for patients' healthcare access and the future of critical care in India. So stay tuned.
Building tomorrow's ICU.
Welcome back. We are in conversation with Dr. Upasana Arora of Yashoda Medicity and Mr. Shalin Patel of Dräger India, discussing one of the most advanced hospital facilities in the country and its impact on healthcare. Dr. Upasana, we already discussed in our previous segment what are the key features of this ICU and the vision behind it. Now tell me something, how is this ICU actually transforming healthcare when it comes to the underserved communities? Can you share some cases?
Yashoda is part of Ayushman Bharat also, and as well as we are part of TB Elimination of India. Underprivileged people are coming to our place and we are providing them free of cost. We are going to handhold this district hospital where these underprivileged people are coming and they are getting treatment. So we are going to give them this facility that they can get that high-end ICU care in a district hospital. If you talk about cases, so all those cases which we are running Yashoda Hospital Kaushambi from last 18 years, we are not treating only one person in a hospital. We are treating whole family. We are giving them assurance that you will be fine. So infrastructure, technology and emotional attachment, all three things has to go together hand in hand. Only then you can provide best healthcare.
That's such a beautiful thought, that you're taking care of the small details also in the hospital. Now, coming to you, Mr. Patel, is this project a model for future collaborations for Dräger in India?
It absolutely is. It is a benchmark in the country, and not only in the country, also on a global level as well, absolutely on par. And it's definitely a template as well for future collaborations. Yeah? And the key factors, success factors, were really, we were involved right from the beginning. The vision was shared by Yashoda. We looked into it. We were part of co-designing the overall solutions. We were aligned in terms of clinical priorities and making the patient feel good, although difficult circumstances, but still making them feel good, where technology and design can contribute to a certain extent. And it was really about building something which is future ready and which is really the benchmark in the country, and not only in the country, even on a global level.
It's truly a benchmark, and for Yashoda, I'm sure it's just the beginning. But what is next from Yashoda Medicity? Are you also planning more tech-driven facilities in other specialities maybe?
Our next project is in Noida, and we are going to create biobank there. Even in this hospital in Medicity also, we are providing gene therapy, cell therapy, CAR-T therapy, which is very helpful for the patients, and all these technologies are totally new. I am a part of Pharmacovigilance of India. Yashoda is an authorized center for pharmacovigilance, where we define which medicine is harmful for the patient. Then we are sending all the data nearby areas, and government is banning that drug and is starting new drug. So we always want to add value, not only limited ourselves to the hospital, that we are running hospital, patients are coming. Even for our employees also, every day there is a training. So I am trying to create lots of more Yashoda who are equipped with new technology, lots of good infrastructure, but same time with human touch also. So I am going to make a biobank and different kind of other things. Same time I am going to make one hospital which will be totally Swadeshi, everything which is made in India. So just because this is a very high-end hospital where people will come by air, and why we have made this helipad to save travel time. So Yashoda has many plans, and I think all my partners, they will help me to do, and hopefully Dräger is now also involved in other projects also. We have one IVF center in East Delhi where Dräger has made our OT. So now we are going to make more OTs in this hospital, Medicity also. So we have many plans in pipeline which we are going to start from 2026.
Great, Dr. Upasana. I think the country definitely needs more thought leaders, doctors like you. Okay, so now let's take a step back and look at India's healthcare from a global perspective. Now, as someone leading operations across Asia Pacific, Mr. Patel, tell us what excites you most about India's healthcare landscape and what is in future from Dräger India?
Dräger is extremely committed to India. We also are in the process of expanding our local manufacturing. So we are actually setting up and scaling up our R&D facilities here in India. And as one of the first products that will be launched in India end of next year in 26 is the first anesthesia device developed by local R&D team in India, and it will be manufactured in India. We are also focusing on NICUs, and we are looking at neonatal. And with that, we have actually partnered up with the Bill and Melinda Gates Foundation, where in 26 we will launch a CPAP device, which is a very basic ventilator for neonates. This ventilator is obviously developed by Dräger with the support of the Gates Foundation. and will be manufactured in India 100% and will be launched next year as well, and should contribute to saving lives of newborns, in particular in Tier 2 and Tier 3 cities in remote areas of the country.
Well, that's amazing work that Dräger is doing. And thank you, Dr. Upasana. Thank you, Mr. Patel. And all the best for all your future endeavors. It's been truly inspiring to see how vision, technology and collaboration can come together to reshape critical care in India. A big thank you to Dr. Upasana and Mr. Patel for joining us and sharing their journey. That's it for today on our special episode, Building Tomorrow's ICU. I'm Radhika Sinha, and we'll be back next time with more such stories of innovation shaping the future of healthcare. Until then, thank you for watching.
Building Tomorrow's ICU.